Hello friends, let us now learn some important points about the congenital thyroid anomalies. Congenital thyroid abnormalities can include thyroid aplasia, where either one lobe or both the lobes of thyroid are not present. So if you see, this is the picture. This is actually from this journal where the thyroid, both the lobes of thyroid are completely absent. So this is the trachea. You can see this trachea. Here you have two muscles, sternohyoid and sternothyroid muscles. And this is the internal carotid artery. And this is the inferior jugular vein. So this is carotid artery. This is jugular vein. But the thyroid gland, which should be present here, is absent. So this is the case where the thyroid gland is not formed. That is, both the lobes of thyroid gland are not formed here, which is called as thyroid aplasia. Then we have thyroid hemiplasia. In thyroid hemiplasia, one lobe of thyroid is formed properly, whereas here you cannot see the thyroid gland. So only one lobe of thyroid is formed properly. So this is a case of thyroid hemiplasia, which is also a congenital anomaly of thyroid. Then we have thyroid hypoplasia. In thyroid hypoplasia, varying degrees of thyroid gland may not be formed. That means either a small part. Here, if you see, this only thyroid gland is formed only till here. That is one complete lobe of the thyroid gland along with the isthmus, and a part of the thyroid, other lobe of thyroid gland is formed. But a part of the this part of thyroid gland is not formed. So this is the case of thyroid hypoplasia. Then we also have one more case of thyroid ectopia. Okay, in thyroid ectopia, it is also a congenital thyroid disorder where thyroid should normally be present in the neck, right? It should be present in the neck. On either sides of the trachea, we have two lobes of the thyroid gland and isthmus resting over the trachea or thyroid cartilage. So, if you see in thyroid ectopia, thyroid gland instead of being present in the neck, in this case, it is present in the sublingual region, that is below the tongue. So, even thyroid ectopia is also a congenital thyroid abnormality. So, in all these cases, whenever either the thyroid is not formed properly, it is completely not formed, or even if a part is formed but a part is not formed, or if thyroid is in some other location, in all these conditions, one common thing is hypothyroidism. That is, the remaining thyroid gland which is present or not present, that gland is not properly secreting the thyroid hormone which is necessary for the normal functioning of the body. Normally, if both the lobes are present, then they produce adequate amount of thyroid gland necessary for normal functioning and normal brain development of the child. But if a part of thyroid gland is lacking, then the thyroid hormone production is not up to the full extent. So as a result, the patient or the child may develop congenital hypothyroidism. Congenital hypothyroidism, one most common cause is dysgenesis, that is improper formation of thyroid, which can be in any of the above mentioned forms like thyroid aplasia, thyroid hypoplasia, or thyroid ectopia. The second cause is dysharmonogenesis. In dysharmonogenesis, the thyroid structurally it looks normal, but it is not producing the required amount of thyroid hormone for its functioning. So this is dysharmonogenesis. Then we have pituitary or hypothalamic hypothyroidism. In pituitary or hypothalamic hypothyroidism, normally this is the hypothalamus. Okay, this is the pituitary gland. Okay, this hypothalamus will produce thyroid releasing hormone. Okay, This thyroxine releasing hormone or thyroid releasing hormone will activate the pituitary gland. This pituitary gland will produce thyroid stimulating hormone. This thyroid stimulating hormone will activate the thyroid gland, which is responsible for the production of the thyroxine hormone. Okay, which is T3 and T4 hormones. Now, now the main thing is if there is either hypothalamic dysfunction or pituitary dysfunction. So either if there is hypothalamic or pituitary dysfunction, this TRH or thyroid releasing hormone or thyroid stimulating hormone are not formed properly. So the push to the thyroid gland is not given. So the amount of thyroxine which is formed will be less, resulting in congenital hypothyroidism. So, what is the treatment for this condition? The main treatment for this condition is to give thyroxine therapy. You will have to supplement the remaining amount of thyroxine which is not produced in our body. So, if this thyroxine is given in the early stages only, if we start giving thyroxine in the early stages, then this will prevent the mental retardation and it will also result in normal bone development. It will prevent delayed bone development because thyroid hormone is very important for brain development and bone formation. So, this giving thyroxine or supplementing thyroxine in the early stages will prevent mental retardation and this will also prevent the delayed bone development. Now, one important thing is how are you going to differentiate between the aplasia or goitrous hypothyroidism? That means in aplasia, there is no thyroid gland. Okay, the gland is completely absent. Okay, in goitrous hypothyroidism, in goiter, there is enlarged gland is present. One condition where there is no gland, the other condition where there is increased gland is present, enlarged gland is present. Now, how are you going to differentiate the both types of hypothyroidism? Obviously, you can use ultrasonography to find out whether there is aplasia or whether there is goiter. Okay, so you can measure the lobes of the thyroid. So you can measure the thyroid volume or thyroid lobes can be measured. This is done by ultrasonography. Then one more important thing is to the detection of ectopic thyroid tissue. We said there is ectopic thyroid tissue. Now the question is how are we going to detect the ectopic thyroid tissue? The ectopic thyroid tissue can be detected with the help of the scintigraphy. That is nothing but a radionuclide scan. With the help of a radionuclide scan, where you give a radioactive material to the body and this will uptake or this will have affinity to the thyroid gland. So it binds to the thyroid gland. Along with the thyroid gland, it also binds to the tissues of the thyroid tissues which are present in areas other than neck. That is, it binds to all the thyroid tissues which are present in our body. So obviously, they will bind to the normal thyroid tissue which is present in neck. Along with that, they will also bind to the ectopic thyroid tissue which is present in other place other than the neck. So this is about the congenital hypothyroidism or congenital abnormalities of thyroid gland. Thank you.